retirement age. And they return back to their states, usually where they came from. They want to be around their families. They want to be around familiar places. Now we see this right now, what's happening. These have the highest elder dependency ratios and projected ratios out to the year 2030. So what are the implications of a high elder dependency ratio? First of all, there's fewer resources, fewer tax base, fewer people, fewer social networks. There's also an increased need for services as a result of aging and obesity. And I know that we're not talking about obesity directly, but right now we see that the implications of that in terms of disabilities and long-term care are dramatic. Where we have Michigan, of course, has one of the highest rates of obesity in the United States, and what comes along with that is diabetes and other very severe health outcomes. This is expected to increase abuse, neglect, and exploitation for a variety of reasons. Number one, just basically if the rates remain constant, just because we have a much larger proportion of the population that is elder, we can expect to see the absolute numbers of abuse cases to increase. But also there's very good evidence that with shortages in the labor force, you get more caregiver stress, those types of things, less qualified workforce, and the potential there is for the rates of abuse to even increase. Okay, after we got a good picture of what the Michigan population looks like today and what it's going to look like in the year 2030, we needed to go out and find out, well, what are the rates of abuse and what is the picture of abuse at this time? So before the Michigan Program for Background Check began, Michigan State University conducted a survey. We did a random digit dial telephone survey, and we interviewed 2,400 households in the state of Michigan with a family member receiving long-term care services. And this is what we found. And it's actually kind of consistent with other telephone-based surveys or other types of surveys. And we needed to do a random digit dial telephone survey because it doesn't suffice just to look at records or institutional records like police reports or reports of abuse within nursing homes. We wanted to go basically to the family members also, because it's not an option usually to talk to persons that are living in long-term care. There's communication issues, and also there could be issues of dementia or something else that makes responses less reliable. So this is what we found out. We see that within the last year in the state of Michigan, before we passed the legislation, before we built the background check system, that persons receiving long-term care, almost 5% reported physical abuse, 12.6 or 8%, I can't see, reported caretaking abuse, verbal abuse, emotional abuse, neglect, sexual abuse was the smallest, and material abuse, which is like exploitation, was at 9.2%. So all in all, about a quarter of the population receiving long-term care experienced some form of abuse. Okay, right now, since we've built the system, since the legislation has passed, we want to come back, and we're actually in the field right now a year and a half later, and we'll come up with a second measure of abuse, neglect, and exploitation for persons in long-term care. Okay, there are many reasons for why there is abuse, neglect, and exploitations of persons in long-term care. Part of that reason is opportunity. Part of the reason is caregiver stress. And part of the reason is also that persons with known characteristics such as dangerous criminal histories might have access to persons living in long-term care, receiving long-term care services. And so when we look at policies, how do we ensure an adequate supply of qualified caregivers? There are some things that we could do, like maximize improvements in health care delivery. We can look at home health care, skilled nursing care, and community services. Another thing we have, of course, is budget shortfalls, and we need to somehow ensure that there's adequate pay for nursing staff so that we have the best possible employees taking care of persons receiving long-term care services. Another thing we need to do is to educate workers about abuse, neglect, and exploitation. And I would also bring up, in the state of Michigan, we also received a grant Lauren Swanson did for Michigan Department of Community Health called the AAMP, or Adult Abuse Neglect Prevention Training, where they did intensive training for workers in long-term care. So this is an excellent means to prevent exploitation and neglect and abuse in long-term care. Okay, the other thing that we could do is we could provide background checks for direct care providers, and then an appeals process, and I'm going to talk about that later on. Let me just say that, well, before we started this, we knew that there was a problem in the state of Michigan where we had different standards for background checks. So if you could be working in one agency, you could be terminated from employment because of neglect-filled behavior and then be hired in a different branch, like between the Department of Human Services and the Department of Community Health, or those agencies that they license, but no longer is that possible. The gap is completely closed. The other thing is people could commit crimes in other states, move to Michigan, and then go under radar. That is also no longer possible. The background check system has filled in a lot of the gaps or potential for hiring people with disqualifying characteristics. You want to talk about what crimes cost to people in general and also to the state of Michigan. There are costs of crimes that involve the victim, the family, and community. And I'm not even talking about the emotional and psychological toll that this has, the tangible and intangible outcomes of crimes. We see that there are crimes directly to the victim, the family, and the community. There are crimes to the institution that's housing them. There's, training costs, legal, licensing, insurance costs. There's cost to Medicaid and Medicare in terms of injuries, rehabilitation, even prescriptions. There's there are costs to processing the crimes from police, judges, trials, lawsuits. There's also precautionary crimes. Agencies, institutes, families need to take all types of precautions to prevent their family members from being abused. I'm giving you these 5 little numbers, and I want to tell you that these 5 numbers here took teams of economists, statisticians, and violence researchers to come up with what it costs to process these, what are the costs to the institution, society, taxpayers. And so right now, in $2,007 in the state of Michigan, it costs approximately $3.8 million to murder somebody. It costs approximately $116,000 to rape somebody. It costs approximately $25,000 to assault somebody, $3,500 for larceny and theft, and $3,000 for fraud. One thing I think it's very interesting is you look at cost to larceny and theft, right? Well, those are crimes intended for monetary gain, and those actually cost the state less than all these other types of crimes. Okay, I just wanted to give a little plug for the Michigan program for background checks here. That's being headed by the Michigan Department of Community Health. And so this project, as I already mentioned, was intended to develop a background check system that would prevent people with disqualifying characteristics from working in long-term care. I just wanted to mention that since the system began, there have been over 200,000 applications for people applying for positions in long-term care. And there's just some brief numbers of exclusions. People who are checked for fingerprints. And one thing that's very special about our system in the state of Michigan is that we created this incremental system that would end up costing the state and taxpayers lots of money. And the way we do this is we do the background checks incrementally, where we look at all the free databases like nurses' aid registries, the sexual offenders registries. We can check there, and if we're able to disqualify people by the preliminary checks, then there's no need for us to go and pay $20 to the state police and $70 to the Federal Bureau of Investigation for doing fingerprint checks. However, if people pass through the initial registry checks, then we go on and we do the fingerprint checks. And here's just basically the end with the number of excluded people runs at about 6%. And there I have a little, whoops, that didn't work. Adele, sorry. It's all right. Okay, and I want to talk now that we've gone through that there, about appeals. Currently in the state of Michigan, we allow appeals, but the basis for the appeals are limited to an accurate record or expunging the disqualifying conviction. For example, if there's a report made in a nursing home, a name could have been typed in incorrectly, and it might have turned up a false positive. And so in that circumstance, people are allowed to appeal it. But that's all that we have right now in terms of appeals for the state of Michigan. And I want to talk about now what are the crime policy implications on this one. We're returning to my discussion earlier about the dramatically changing population structure and projections. We see that we are having fewer and fewer workers relative to the population over the age of 65. We're already experiencing shortages in healthcare providers, and we expect those shortages to increase over the next 25 years. And I want to talk a little bit about the potential for an appeals process and why we might want to consider that. One thing a lot of people talk about is, we definitely want to prevent unqualified people from working in long-term care. We definitely want to protect our most vulnerable populations. However, I think that people are very shocked sometimes to see what's the proportion of people that have an encounter with the criminal justice system. So for males, before the age of 21, more than 90% will have some kind of an encounter with the criminal justice system. It doesn't mean that more than 90% of our population has this sociopathic criminal-like behavior. Most crimes are committed by youth, and youth are dumb. I mean, they do dumb things, right? So I was a teenager. I know all of you were, and many of you have teenagers are dealing with this. Teenagers do dumb things, and so do we want to create the system where those people are prevented from working in long-term care? And there are a lot of ramifications for that, one of them about not letting them to be rehabilitated. And so maybe when we talk about public policy development, we could think about things like letting people prove that they have been rehabilitated, show that they're good citizens, and that they're still accountable for what they did. And in no way am I saying that people should not be accountable. However, some crime that was you were charged for when you were 16 years old, that's never been reoffended, like some type of a drug felony or something like that, we should maybe consider that in an appeals process.